as I said before, they have a pharmacoequity tool, which I think is just absolutely outstanding. I mean, this is a tool where they were looking at equity issues. And they started off with sort of racial issues, and they have expanded it to the social determinants of health. And I think that sort of thing is a great example of the work that they have done. Now CVS Health has all these resources and this massive footprint, and so that makes absolute sense for them. But for smaller, organizations, it may be, cards, signage in other language or those sort of things. I think that a lot of what we talked about, I don't want to steal Joel's sort of fire on this, but their pharmacoequity tool I found to be very interesting. I hadn't seen anything like that, and they are rightfully very proud of that work. And that's one of the examples that we will give. But we also, I mean, you have to look at, staffing. You have to look at the people who work within your organization, making sure that you have, diverse representation. The research says that people generally receive care better from somebody who they have something in common with, whether that be language, whether that be look, whether that be background. We have a community health worker program where we talk about people out of the community helping to connect isolated populations into care and those sort of things. So, but the focus of ours is going to be their pharmacoequity tool is really sort of the whiz bang that we're going to talk about the examples of. Well, for URAC, Asembia is like a family reunion. I mean, we do so much work in specialty pharmacy that we have organizations all around who come up to us. And Asembia was the first big conference that I went to after I became the CEO at URAC. And I was struck by at Asembia, we had people come up to our booth who were from organizations that we accredited, and they wanted to hug their reviewer. And I was standing in the booth and I'm like, in all the times I've been through an accreditation, I have never wanted to hug my reviewer a single time. But the way that URAC works and the fact that we have our own reviewers who build relationships with these organizations, it's a wonderful time. I mean, people come and they give us feedback. I've had sessions where people have come up to me. I mean, we've changed things within what we do. My very first time going to Asembia, a person came up to us and they said, for a small pharmacy, you cost too much and you take too long. And we created a program that was cheaper for small pharmacies and didn't take as long. And I think that, I'm very proud of our organization and the people that we work with and the feedback that we get from our customers. But also we care about how you deliver care. And as an accreditor, our job isn't to catch you doing wrong. It's to help you to be doing better. And I think that that's really sort of Asembia is a great gathering of sharing best practices, of sharing leading examples like what CVS is. And we're going to talk about, we're also getting ready to launch a new specialty pharmacy update accreditation. And so there's a lot of interest. We have a pre-conference meeting on Sunday that's going to have a lot of people at it to give us feedback as we build that program. So, specialty pharmacy is delivering some fantastic care to communities around the country, and we're excited to get together and to hear from them and to share our stories.